from Louisiana's home team. This is Fox 8 Morning Edition at 6 a.m.
7:22 your time, and doctors stress getting screened for conditions like diabetes, heart disease, and cancer. But some patients may view eye health as a little bit of an afterthought. Dr. Joshua Groetsch joins us with People's Health in studio on how to spot the warning signs of eye conditions like glaucoma. Thank you so much for joining us.
Thank you for having me.
All right, well, for those who may not know, what exactly is glaucoma?
Well, glaucoma is a group of eye disorders, basically, that essentially lead to progressive damage to the optic nerve over time. So the optic nerve conveys information from your eye to your brain, so if you're damaging that connection over time, you're going to lose vision. It's one of the leading causes of blindness, and in particular, it's one of the leading causes of irreversible blindness. Therefore, early detection becomes a key to hopefully catch it and prevent it before you've had a significant loss of vision from it.
Wow. When you talk about the potential for blindness, it's certainly, it could put a little bit of concern in folks. What are some of the risk factors?
So risk factors, it's a disease of aging. Unfortunately, there's a lot of diseases that become more common as you get older. So age is one of your biggest risk factors. But in addition to that, your genetics and family history play a part. If you have family members who have glaucoma, then there's a higher risk that you may get glaucoma yourself. Race plays an issue. We know African-American races are more common than other races to get glaucoma. And then certain medications, prednisone or steroids in particular, lead you to an increased risk. And then if you've had trauma to your eyes, that's a higher risk. Certain medical conditions too, and particularly diabetes, put you at a higher risk for glaucoma. Okay, and so it's so important to get these things checked out. A routine eye exam, would that pretty much cover it? A routine eye exam should cover it. It's important always when you're getting your eye exam. One, I mentioned earlier that it causes damage to the nerve. The way you get that damage is because you have high pressure in the eye that damages the nerve. So in a routine eye exam, you should usually have your eye pressure checked. It's also important, though, that you get a dilated eye exam too, because it is a kind of a group of signs that we look for when someone has glaucoma. So just an eye pressure alone is not necessarily enough to say you don't have glaucoma. You want to kind of monitor the appearance of the nerve and the function of the nerve to make sure there's not another sign that you may be getting damage at what we would normally consider a normal eye pressure. Yeah,
so we're talking a comprehensive eye exam.
Correct.
I've worn contacts for pretty much my entire adolescent life and, now into adulthood. And the tests that you get, they're valuable because they're able to spot a lot of different things, not just, glaucoma in this
Correct.
case. But what are some of the, some of the symptoms when glaucoma is first apparent?
Well, I think the biggest problem with glaucoma, and the reason it leads to so much vision loss, is one of the most common symptoms is that essentially the vision loss you get is asymptomatic early on, and that's because there's a discrepancy between the threshold at which you will start to have damage to your nerve and lose vision versus the pressure in the eye that will actually result in some type of physical symptom that you feel. In that range, there's about a 20 to 30 point range where you actually will feel anything. When your pressure gets beyond a certain level, you will start to get signs such as pain, a red eye. People report halos around lights, a sudden loss of their vision. But unfortunately, that pressure takes about twice what is considered normal before you start to feel it. A normal, or not a normal pressure, a slightly elevated pressure that technically would lead to a glaucoma problem, most people are not going to know they have or feel, because it's just going to lead to slowly progressive vision loss in your peripheral vision over time. And I always explain to people, if you have a point in your life where you can see, 180 degrees out to your temporal side, and over the course of several months, you move in a few degrees, you're not going to notice that, and that's going to progressively happen year by year. So remarkably, you'll find people sometimes who don't go through eye screens, who come in for their first eye exam with very advanced glaucoma to the point that they're only seeing tunnel vision because they have not had their eyes routinely checked, and no one's ever picked up that they have glaucoma, and they've never had a physical sign of it.
Wow.
So screening becomes important, obviously.
Yeah, screening very important. We appreciate just kind of the word of advice for folks who may not have even thought about it before.
Yes.
All right. Thank you so much. We appreciate it.